So in this lecture we are looking at three categories of drugs. Okay, so we are looking at drugs that are smooth muscle relaxants. We are looking at drugs that are uterotonics. We are looking at drugs that are tocolytics. So it's just to list examples of drugs that actually fall under the categories, and briefly state what they do to the body. For the pharmacology of those drugs, we'll have lectures later on which we'll discuss, right? So what's a smooth muscle relaxant? That's the first one we're dealing with. So smooth muscle relaxants, you should know that those ones, they are drugs that relax the smooth muscles in different organs. Smooth muscles in the respiratory tract, smooth muscles in the blood vessels, smooth muscles in the gastrointestinal tract, smooth muscles in the uterus, smooth muscles in the bladder. Okay, so examples of these drugs, we have the ones that are actually relax smooth muscles in the respiratory airways. Those are known as the bronchodilators. So drugs like Albuterol, Salbutamol, Terbutaline, Salmeterol. We have the Ipratropium, we have the Tiotropium, we have the Theophylline. Then we have the vascular smooth muscle relaxant. Those ones, they relax muscles of the blood vessels. Have drugs like the nitroglycerin, we have the isosabide dinitrate, we have the amlodipine, we have the nifedipine, we have the hydralazine, we have the sodium nitroprusside, we have the minoxidil. Then drugs that will relax muscles in the gastrointestinal system. We have drugs like the dicyclomine, hyoscine, also known as the scopolamine. We have the meberberine. Okay, the urinary tract, drugs that will relax muscles in the urinary system, because sometimes you can have some 1 or 2 contractions there. So drugs like the miraberon, we have the oxybutynine. So we have another class of drugs which are known as the uterotonics. Those ones, they relax the uterus. Okay, so they increase. Uterotonics, it's not relax. So these ones, they increase the uterine contractions. Okay, it's tocolytics that relax. Uterotonics actually increase the contractions. So tocolytics are opposites of uterotonics. So for uterotonics, we have drugs like oxytocin. Those ones will make the mother contractions actually go up so that the baby is expelled. We have drugs like the ergometrine. We have the methyl ergometrine. Those ones too, they increase uterine contractions, mainly for childbirth or after childbirth. If there's bleedings, you give them so that the uterus can contract back. Then we have the prostaglandins, we have the dinoprostone, we have the misoprostol, we have the carboprost. All of them, they stimulate the uterus, they make it contract more. Okay, then we have the tocolytics. Okay, uterotonics, they give uterine contractions, while tocolytics is mainly for relaxations. Okay, so you can say that they inhibit contractions. So most of the times you are giving tocolytics because the mother is having premature contractions, so you want to relax the whole situation so that it doesn't lead to premature birth ASAP. Sometimes you want to buy time to calm the mother down, to buy time for yourself and arrange the whole hospital environment and all of that. So we have drugs like Terbutaline, we have the Ritodrine, we have the nifedipine. Okay, we have the atosiban. Then we have non-steroidal anti-inflammatory drugs like indomethacin. Alright, then we have the magnesium sulfate. So that's what we have for these three categories of drugs. Okay, smooth muscle relaxants, uterotonics, and also the tocolytics.